Iqaluit, good morning, everyone. My name is Sima Sahar Zerhi. I'm Premier Akeeagok's press secretary. Today is Thursday, January 20th, and we have the Premier offering a short statement with today's case counts and information on a new COVID-19 initiative that's being rolled out. We have Minister Akeeagok, who's available to offer additional details about that initiative. So he'll be available at the question period. The Minister Main is going to offer a statement about COVID and health, and the CPHO is also offering a short statement around COVID-19. Thank you.
I can't see. January 20. Sibulek House Chahalanga, you had children in Nikamalo, Nunavut Tulerin and Iqaluit. Akeeagok at now may you have a song now like Hapeksota Gunala, you touch Mamichano. Minister Main of Halimalang and Nunavut Michano, Marana, Hanang Tuleric, Amalo, Anna Hanang Tulerimai.
Koyaname, Sima Makoyaname. Udlakut yapaka Nunavut te pilong watu me Iqaluit nalatum udlangoyo naluneru nasivu Nunavut iluane 175 ngulupu nuwana joahatum takwa 19 nunalen atoktosumayum arveanen kamanituame 35 Iqaluit 16, Atausir Idluligarjunen, 4 Sadlernen, 0 Idlulimin, 16 Iqalunen, 1 Ursuktumen, 14 Kinganen, 0 Kugarjunen, 12 Nauyanen, 0 Panutumen, 0 Mitimatalumen, 1 Hikirtarjuamen, 17 Kangitlinumen, 4 Sanagayanen, 11 Sanikiluanen, 5 Talorjuanen, 3 Tikirarjuanen. Manau yok udlango yok nalunersigum narivugul 50 ulurtun nuvannerjuaqarunnertui udlango yok katillugin 428 ngulurpun nuvannerjuaqarunnersimayun tamanna nunavumu isilausimaningane pigiarlumen. Udlango yung kuya sutiapunga naluner sikannerunagatta gavamaudluta qanno ikayurunang ikalwa mangata nunavumiutane piliriaqai nagatta udlango yung naluner sikunnarsivugul 625,000 takwa umayong nertikun turangan nertun kinauye sanervegun nagatikut udlango yung takwa umayong nertiliman 25,000 pinyartum Kauyumagata angunasutti nunalitinin nikinin inusiutinin atuinaruivadialluti pimarjuangumatam takua umayong nertiku isumarsuutiginniartangi qanno kinauye aturtaugunna jang kalwamangatam takua tukisigiartau kannerumagune avatilerijikkun uqaalayagunnarpun 1-867-975-7781 uvalunen qarasau yakun j@gov.nu.ca qoyannamerumattia parataanna minister Akeeagok taassuminga assuruaqattattaarlunu saqqiigunnarmagu taanna udlaanguyung minister Akeeagok tavvaninniartu kiugunnarlunu apeqqutissaqartoqarune taassuma iluanen saqqittam nunavummiun iqqaitittiarumavakka taanna Nikagosugiaharnittinni taanna piluanguartum ilinniarvikuluppu mappeqallianialemmata pinasuarusiulaattum taanna eqqaitittigiakannerumavunga angiqarsimagunnarusi angiqarsimaqattaritti inugialuaqattartiilillusi kateqattartun kapuurtaugunnarussi kapuurtaullusi kiinarmi matuarsimagunnarussi matuarsimainnarnarlussi amma nuvannerjuaqaqarissiguigussi taakua nalunertauluten anniasuutin uqaalautin taiqattartavun so taakua pidjutigillutigu quyannamerumattiarpunga nunavumiutanni udlakut to Nunavut, especially our elders listening in this morning. As of this morning, Nunavut has 175 positive cases of COVID-19. We have active cases in 19 communities. The reported numbers are 35 in Baker Lake. I got to get the corrected number for Alvian. 35. 35 in Alvian, I apologize. 16 in Cambridge Bay, 1 in Chesterfield Inlet, 4 in Coral Harbor, 0 in Iqaluit, 16 in Iqaluit, 1 in Joe Haven, 14 in Kingain, 0 in Kugatuk, 12 in Nauyan, 0 in Panokto, 0 in Pond Inlet, 1 in Hikatadzwa, 17 in Rankin Inlet, 4 in Sanagayak, 11 in Sanikilua, 5 in Talodra, and 3 in Whale Cove. We have 50 reported recoveries today. There have been 428 total reported recoveries since this outbreak. Today, we are announcing the final initiative in this round of Government of Nunavut's COVID-19 response plan. We have allocated $625,000 in direct contributions to each of the Nunavut's Hunters and Trappers organization. Each HTO will be receiving $25,000. These funds are to support the harvesters in providing healthy country foods during the COVID-19 pandemic. This money could be used to organize and pay for the costs for harvesting. For details, please contact the Department of Environment. My apologies. You could email j.aliqatuktuk@gov.nu.ca or call 867-975-7781. I'd like to thank Minister Akeeagok for this work. The minister is here to answer any questions regarding this initiative. I want to remind Nunavut to do your part to keep our communities safe, especially our children as they return to classrooms next week. Please continue to stay home when possible, stick to your small bubble, get vaccinated and get your booster shot, wear a mask, and alert the COVID hotline and isolate if you have any symptoms. As always, be kind. We are all in this together. Hoyannamin.
Blacha Bla ko hakawatunga kaputin at nilere kuto nuwang na ramut kano pimmakayo tigip mangata man na ulakto immakatu ho maluktalak pugut to hak maluktalak pugut Dr. Patterson min ammalu ahingit nidlu so kayo unique na yung kayo unique kapiyaw ko iblutik Iqaluit kaming mata. Akeeagok, kapiyaw lutagok. Nuwang nalarang mo at nilagay kutaw yumot. Ati aperinyak putin ilailit ni aperigin. Kapher lutik. Taman na tuhak himalik piyo. Nuwang nalarang pigilok titlugo nunalarang mi. Amma ati aperikan nirit ilitnik. Hukia, taman na okaw hiugayuk pa, ublu taman, nguyak to tuhak takap tigo. Kiubungay ma, taman na hulid lakik man, okaw hiugayuk po. Taman na nuwang nalwa, nutak, Omicron ngunak tawyok, ahyanik, ilak ko hekakalwak tilugo, nuwang nalwa ngulaw kimayumik. Ammalu ay torlukto kaktulo ang nakautillugu Omicron the bolak tillugu kablo natin more contagious Tap ko ako herega kaming itangit. Iswa kayak yuk huli larik tu huli. Tamak ko ata ba huli yut. Ako herega ukwa at nilagay ko tayo yut nuwang na lang mukaputit COVID vaccines. Ikayong nakadlarik tu. Kapiyaw himanik tunod. Makuktu galwak pata. Ubaluni inu to kau galwak pata. Ang maluuk tamakwa kaputit o kau herayak ka, miyanik kinyang ming. Hakkay lakay hoktun. Ilagit, iluani, iglu, iluani. Ihumagiblugot taman na. Pekan nakit, ihumagiblugit, ubaluni, pilire katigi, kanaya katigi. Ihumagiblugit. Kanuing ipala ko tao hoktut, kaputi, ikayong nakadlakik tu. Nuwang nalwa ang mut at nilagay ko tayo kaputin. Taman na o kauhiyong ngay nakaluak ti sugu, ublu tamango yaktok. Ihumalok to nga, huli, ami huluak to Nunavut mute, kapiyaw himangi mata, chit tumut, ubalunit, ilang agawin nak, kapiyaw himayun. Ami huluak ahugiblugi, ihumalo tigiyak ka. Taman napit jutigit sugu ublumi aperilak punga ilagiyaw yunut ubaluni pekan nakayaw yunut kau mayakang na COVID kapiyaw yakakak tumik ubaluni kapiyaw ka nakakak tumik nuwang naluang at nilagay ko tayo yumun ati tem na kau mayat o kakatigi ako na o kakatigilugo nalaglutillu hunanik ihumalu giya kak mangat ape kohik kakak mga kano atuin naktakakaluak man nalunang ngitsak tunik unikak tunik kaputit mikkanut tamakuni nga takuhuang napata ikayokotem na kauyimayat imakanagligiyat akay ko katigilaw kotem na kauyimayat pekan na kaya ilagiyan. Appointment leo katigilugo. At awing mo, kapiyaw yun luang nakman. Kau yung mayung agad luang taman ko kaputit o kau herilirangap tigo. Ang yakatigit tuwin na ni ayuhok tugut kapilong ng mo lahat ni kutikit tahok sutalo. Taman akong naktuho kaluak tigo. Hapila ko yung ito nga ilagiyaw yunik, pekan na kayaw yunik. Ati taman na pilirakin na uyak tigo. Kingudlak pamik, mat na ako akto nga, mayor giyaw yumut, ang malukati mayigiyaw yunut. Tamak kuno nga, ukuno nga, hamlet giyaw yun akwiyani, hamlet giyaw yun lu kangyak sinang ming, ang malunun na lipaw yak kuni, kalung ni. Ukuha tamak min, pingahot, nalo na yakimap mata, pekawyang minila hakkay niyang nakakimap mata hakkay himablutit lunit, hakkay himanik lutit lunit, kapiyaw himagyak kang niyang mik, atulak tichi niyang nakaklutik, iglo ko tingit ta iluano, itang nakatuluk tanot, kablo natin ito vaccine mandate. Hibuliong nakayahi, ikayong nakakimawok, nunabumyunig, kanwing itya ko inang mut, nuwang nalwalakay naktautuk sugu, mat na tiyamak, ikayo kapi, amihunak hanging nunabumyutani, kapiyaw himakobluhi, koyibluhi, pilakay kapi, mat na. Good morning. I'd like to speak about how important vaccines are in the fight against COVID-19. By now, you've all heard the experts, like Dr. Patterson and other respected health professionals. You've heard them urge people to get vaccinated against COVID-19. Ask yourself, how many times have you heard this message, get vaccinated? And ask yourself, why do our experts keep repeating it? They share this message and they repeat this message because it's true. Despite Omicron being a new variant, and being more contagious, their advice is still critically important. These are the facts. The COVID vaccines still hold great benefit for those who roll up their sleeves, and vaccines still help to keep our families, friends, and co-workers safe. Despite the repeated messaging, I'm concerned that still too many Nunavut aren't vaccinated or are only partially vaccinated. And so today I'd like to appeal to the families and friends of those people. If you know someone who needs a vaccine, please speak to them, listen to their concerns. Help them to access reliable information about vaccines. Help them to book an appointment. And I know opinions on vaccines can be strong and it can be frustrating at times, but please don't give up. Finally, I'd like to thank the mayor and councils of the hamlet of Iqaluit, the hamlet of Rankin Inlet, and the city of Iqaluit, who have all decided to implement vaccine mandates for entry to their facilities. Your leadership is helping the collective effort to protect Nunavut from COVID-19. Matna for encouraging more Nunavut residents to get their COVID vaccination. Thank you.
Good morning. Earlier this week, one Nunavut died due to COVID-19 infection, and I would like to take this time to express my condolences to the family who's lost a loved one. This individual was over 70 years old and was not fully vaccinated.
Atausiak Nunavut inugunnersimani ngano Nuvajuanak 19 pijutigillugu naggajaumi unnukut. Taima ukhawsakhakumabunga mamia bigilugu ilagiyangid ilailautut nalligiyammining. Tana kapiyawsimalaungitok ammaluki ukhalauktu 70 ungatani.
Over the last week, there has been a significant increase in the number of infected individuals in Baker Lake. As a result, schools in Baker Lake will be at half capacity when they open next week. Moving forward, we will, Moving forward, we will continue to assess each community on a weekly basis, and when appropriate, the capacity at schools will be lowered for 1 to 2 weeks. The goal is to keep the risk of exposure to the same level or less than the risk of exposure due to other activities in the community. One daycare in Iqaluit has closed due to a COVID-19 exposure on site. Testing and contact tracing is taking place. Thank you.
Pinasarusiu simayumi tay mami songopalya simalaki matata ko ano ba Juanak ta simayut kamanituami. Tay may mat ilinnerbi kamanituami abay nang inig matuyat tawlak tu matuyat kata pinasarusiu lak tu mi. Sibumuga palya tiluta suli kawi sa palya inalangaya buwatu ni nunalin ni pinasarusi tamat. Tay may gaharap taluta ko ilinnerbi katsini upataw gunang ni katsina o kaktaw katak simalangayo pinasarusang matawsang mimakon nun. Tana to aga harato lo kaya naktumit tayo nak mo tayo mag ano ba jo anak tuling ni tayo masingin ni kanoili ko tayo yun nunalin ni ka sa makpalyago tayo to yun nakalin ni ilang ataw si pairibig ikalun ni matuyaw si malektor no ba jo anak 19 ta si mayo halaungan pairibim mi kaya isak tayo balyayot ang malukatiyaw si mayo ni kaya kay balyak yuiman na.
Kent Driscoll, APTN National News. Dr. Patterson, the last time we had problems with the water in Iqaluit, it had an impact on the hospital and therefore COVID response and every other medical response. I'm wondering how impacted is the hospital right now by the current water problems going on in Iqaluit?
Ketris ko ipitian kun niluta Patterson taman na imar nilohan ni tino iqaluit na balo matri simalonga malo inuili saigun na mo pijutigillugi khanoli taman na tuina khasma bamanayo.
Right now, it's not impacted at all. The boiled water affects delivery of water to patients and staff, but the levels of hydrocarbons do not affect sterilizers and other operations, so those are unaffected.
Manayo taman na tuina khasmangito tamakko kistani tiqtitit sakhattakuyayo unit simayunun amale kanayak tingin na belome taman na uswalo khamninga manayo tuina khasmangito takatumunga.
Dr. Patterson, you already reported the outbreak at a local daycare that's forced it to close, and I've also received reports from at least one of the shelters here in town. I'm wondering, what's the bar? I'm wondering how many COVID cases or how much COVID do we need in the community before you decide to move schools from part-time attendance to full remote?
Luta Patterson o hakauga bisa makto khasma juminuni ngani pairidio ilangani tusarsimalo nilo ang ikahangit COVID me ser makto kharnereanga khatsiul khatata manu David Joanasie nunalin ni sorlu tamakko ilinna beilai nangago matuinga yaw khatalaqayakhan.
We'd be looking for transmission that's greater than what we're seeing in the community itself.
Khawli ka sa kayaktigo sa mapalayo ham mga pinaksoyo ni nunalin ni sa mapalaning inasingin ni.
Jackie McKay, CBC. My question is for the Premier. Lots of residents in Iqaluit are calling for the bottled water distribution to open back up. Is the GN planning on funding bringing more bottled water to the city?
Jackie McKay, CBC, kunya halumiyugo tamakuninga imil putos pukaptos mayon pikkan na kamalangata nunawoga ba makungita makuninga to inautit siniusaban.
Kuyan na may tan apakutitiavan tan pivadya yulagiko CGS ko ministro ngatavan katudja kata katya sima vadlangin na sima maimala kunam tan kiuting akon na ko kanu siyang ikubin. Thank you for the very important question. Minister Joanasie, who is CGS minister, is here, so I'd prefer if he responds to that particular question.
Apakutinu takwa annartalileriik kunalunarsiqattatillugi immaqa imma takhalaqtitaugiaqpalu balunni tiqtititauqqaariaqarpa imiqtauloqqaartinnagu ammalu ilangittau sorluuttuutigilugu ukiaksaangulortumi hugasubbiu ullunginni tikiloqqaartinnagu Iqaluit takwa imangani imittailileqaaqtitaulormata takwa ajigiilaungimmatti kisianilu qaulimalugut taikwa imait tunuqqartauqattalortuit isimagijautillugi maannakkut qanortuuqasuarpallialagu ammalu taakwa nunani paulakkut immaqaapileriqatigivalliagumaniarsutu taakwa imaqtaariaqallattaartu piluartumi ulueraanartumi iqunagit balunni innakuluppu balunni ajigingittuni pinailutalit isimagiluarlugit taana qanortuuqqalliagasuarumaniartavu sibunittinni. Thank you for the question. Just in terms of, there's two separate issues. Well, there's the boiled water advisory, which is separate and different from do not consume orders, and those are managed through the Department of Health. But in terms of, we know in the fall before Christmas, there was a do not consume order, which prompted delivery of water services in the community of or the city of Iqaluit. We are looking at possibility of having a water distribution specifically around vulnerable populations here. However, those discussions are ongoing, and we're having meetings with the city moving forward.
Thank you. I just want to clarify something you just said there. So, yes or no, is the government in Nunavut planning on flying more bottled water into the city?
Kasi nakit siya kay nakangirlut ya garlut iluni tikitit sila nga bisi imamni.
Mana ko aka tana isi magayang utok kasi ani pijara katwarutta kanuktong natawutan. At this point, no, we aren't planning to order more water into Iqaluit, and we'll go from there. Thank you.
Hi, David Venn, Nunavut News. This question's for Dr. Patterson. Dr. Patterson, are you able to tell us how many total and ongoing hospitalizations there are?
David, Nunavut News kuniluta Patterson hatsi ulang mga tana belum na unit si mayokaut sigun nake.
The total number that I'm aware of hasn't changed since Tuesday. It's 10, and I don't know if anyone is still in hospital.
And a follow-up.
Hold on.
Oh, sorry.
Okay, siya kayo managadjaw le nagadjaw le kinahuli yung mata asid just si mabalang ito eh.
Last week you said no community had more than 5 hospitalizations. Can you tell us which community that is?
Pinasa ako si ulo to may kayo gawi tali maus mangit nun ataw sa may nunalid ni nga si mayo kaya akong nakinalyan ni nunalid ni mga ta.
That there isn't a single community that's broken that 5 threshold, so we're not going to get into the details of numbers per community.
Okay, thank you.
Nunalid ni tali mayo nga tano si mayo kang imonit si mayo ni ana ba lumitay ko ay luling yo ka sa rijang itabi nakingang mga ta nunalid mo.
Trevor Wright, Nunavut News. Dr. Teresa Tam recently mentioned COVID-19 will likely become endemic. What does that mean for Nunavut?
What does endemic mean?
It means it's always there at sort of a baseline level.
Trevor Wright, Nunavut News kunilut Teresa Tam. Tano kasi mamataman na sakyo may nam na alam nga ni sir mapalangin na nga taman na lakano is magbiyo tama no na mo.
I don't think anyone knows for sure what exactly the endemic state of COVID-19 is going to look like around the world. It's accurate to say that it's going to be with us forever. We're not going to be able to get rid of it. But beyond that, and when that's going to happen is really hard to predict right now.
Kinatuin namin na taman na sakyo may nam na alam nga ni sir mapalyan ni kaway mayang ito tamani no nakjami. Kasi ano harong naktigo taman na pitakay na lang alam nga ni tayo mga 5 kamalo nungo titagun na jagon nerso ni. Kasi ani tama asingin no taman na ilak nalo nakto hangag ko gayak mga taman na sa mapalyagon ni kayak ni nga.
Next question is for David Akeeagok. How would the funding to the various HTOs work? Like is the country food going to be given to residents for free, or how is that going to function?
Hanulita ko kino yata ng yutimi yunan nunalin no ta ko kano inulak tani nakitatit sa kata ng makikalaka balo kano taman nawala na kalanga ba.
Oy nami Tako umayong natilima 25 nunalin ni 25,000 ni ang irotiko tunin ni aksutigun tako kano atok taw ni angin ismaksuti yaw ni aksutin surlo ang una subtitigo magotin tako oksuarong inun sunagang inun nyakingin nun upalo ni asingan ni nunalin ni niyo magotin tuktuin ang mindilo ni tamak kuning ako temen na Asia maksuta katyanertun takwa kano ilinga go mamatkia kisa niki piya pata takun ngano na lilimanu tunga se kunyartavun. Thank you for the question. The parameters around the 25,000 for the 25 community HTOs is flexible within the limits for if the community wants to have a community harvest and they can organize it, they can buy the fuel, the food, add the ammunition, and organize a hunt through that, or they can go and purchase from another community such as caribou meat or anything. All we ask the HTOs is that they distribute the country food within the community. Thank you.
I have a couple of questions on behalf of Matisse Harvey. The first question is for the Premier. Premier, can you give an update?
Tāna naluna padliangin nakatigo tāko avitoksimayon government tāko kawisako tigo yagunan natin government okakun niruti apogo tāko January 25 ngulon tabunga Nunavut munasiu diyaw ni ano ataw simalumata tāko pagna padlia simayav kano avitok padlia na kalwang mga tigo tāko tiki padlia yun piduang watu mikay tāko kana yatin sivunitin Auluan atau merata tu pilih 6 minilin amatakwa hamalau yun so takwa nari witiatavon tiki kute takwa kamagi vadlian anita. Thank you for the question. We've been working very diligently with the departments in terms of securing obviously the rapid test kits. We're anticipating those to come to Nunavut to be shipped on the 25th of January. So right now, as indicated many times by Dr. Patterson as well as Minister Main as well, once we do receive those, we are hoping to break those down and disperse those to both the frontline workers, the businesses, as well as the municipalities. So,
my next question is for Minister Main. It's from Matisse Harvey again. Minister Main, on Tuesday, there was an announcement of the federal government would send 3 nurses to Nunavut. How many more nurses would be needed in order to fill the current gap and reopen the health centers?
Tabangat sa na Matisse Harvey mi kayo gatsi naggadyaw le kami ka matukakwa na siortini tikitit sila ngata katsikan ni ana siortara hakisi amigang na ni nakata.
Matna, thanks for the question, Matisse. I can't say at this point in terms of what the gap is. The number fluctuates so much in terms of our staffing levels that it would be dangerous for me to give a ballpark figure even. But I can say that the staffing challenges are significant in terms of the nursing, the need for additional nurses, and part of the issue that we're dealing with in terms of nurses is being competitive nationally because nurses are in high demand across the country, especially in response to COVID-19, and part of our difficulties are the ongoing negotiations with the Nunavut Employees Union. Nurses are part of the collective agreement, and so in terms of a new salary and benefit package that would ideally be competitive nationally, that is still a work in progress. So, tamat tumamik kanu na hauti mi khinak paluk man apereyo tabu na kiyo kaning ni ayok lugu aheng ok tau yen na hokman tamanna nayengwa kikkarneriyavut la nayengwa killeorneriyavut pilleriyilleorneriyavut nayengwi tautuksugit kihiani nayengwi Canada iluani piauha kemadlareng mata nuwang namralerenak piluaktung pidju tautillugu amma tamanna tulok tarutigiyavut maanauyok amma tulok tarutau miyok ukwa aiba katigi neriyawut maanauyok nunavummi ekkan gavomakko ekkanayak tingit takatu yakatigi kungillu ekkanayak tuleriyikkullu Nunavut Employees Union collective agreement negotiations tukihinnanginna umma inuktu qablu natok para tamanna iglaqtippagit tamanna tulok tarutau miyok Canada miut aviktok himan neriyaw yu Canada iluani tautuk sugit kanigin nilugia kharaptigu ko akina ya leagayaw hoktut aviktok himan ni ahingin tautuk sugit tamanna pilerenguin na yaktu galwak kihiani tulok tarutau miyok nayengwa killeorneq pidjut ihumagiblu matna.
Kent Driscoll, APTN National News. Minister Gross, please. Minister Gross, this is the third school year in a row that there have been major disruptions to instruction due to kids being sent home because of COVID-19. That's a lot of instruction time and a lot of kids behind where they ought to be. I'm wondering, long term, what's your government and your department going to do to try and help recover the lost learning that's happened over the last 3 school years?
Kent Driscoll, APTN kunni pinga Joanasie qagungan iligatta tamanna abberta winnatillugu ilidnaaru narningi Nunavut 19 pidjutigillugu annaisimallari mata ilidnaarunnaarutigilangalaortanginni taimali khanok tamakkua angummatiliqasuarlussi khanu iliulaaqissi.
Juana, for the question. We all know how important education is and how much we can learn together again. In terms of working in the school environment, and we encourage all parents to send their children to school so that they can gain that learning experience. And in the document Learning to Be Together Again, there's information that we have prepared for the students to be able to learn as much as possible throughout the year.
Hauya mayuinna gatta tamanna ilidnaarna pimmariuninganut ilidnaa hatigigunnaarna ilidnaa bimmiillattaarluti taima ajaurtureaqakkanga yoqqaariyaaju taima ilidnaareartitsiqattaqullugi taima taakua titiqarsimayut ilidnaa hatigiippallaa kannerunnaarnermi titiqarsimayu tukisigiarnartoqartu qanu tamanna ilidnaartuleqineppigiartau kannipallaanaarmanga.
Minister Gross, you really didn't answer my question, so I'll ask it again. Specifically, what is your department doing to try and make up for the lost instruction time? And I'm thinking especially of the kids who don't have as many supports at home. If you have a lot of supports at home, you can finish your package. If you don't, you probably aren't. So again, long term, to recover this lost time, what programs or policies or ideas does your department have?
Kiotangin na biwapiriyanga naluna jaygia kannaluti tamakko ilidnaaru taugunniirunnarsimaningin ilidnaartinu qanu angummatiyaulaqasualaaqaat ilangangiqarsimaluti ilidnaarunnatsaaqattangimata taima sivunitsatinni qanu tamakko pigaartau kannernaaqa ilidnaarti angummatilerpallaagunnaqullugi ilidnaarutingin.
Juana, as we know, each school has either 100% back to school or 50%. And for each school across Nunavut, I know they're working very hard to ensure that the students are learning as much as possible. And this week they are doing remote learning, and working from home is different for each student. We know that everyone comes from different households, and each teacher is working to ensure that they're taking into consideration what each student has. There are a lot of things that right now we need to ensure that students will get caught up, but I think that's the norm across the country. We need to kind of navigate these times as best as possible and work to encourage the parents that their children are working on their remote learning packages and submitting their assignments and getting graded for those assignments that they are submitting.
Hoi magatela ilinna beilun atangirtumi matuilaarninginnik ilangi abbainanganni matuingalaartillugi upattaugunnarningit atuni Nunavummi ilinna biatsoruutiqartu tamatumunga ilinnaatsaaqannerunnarrullugi tamakkuali tabani pinasaarussерми angiqqarsimalluti ilinnaartitauyut atunillu ilinnaartitsiti nalunaarsisimaniangata tamakku atuni ilinnaartingi ilinnaarut itsanik piqarunnaqattarullugit utertitauqattarluti pijariirsimayangit Hanutuinna pilerigunnaaratta tamakku ilinnaarti taimaatsainnaumma takanatalimaami taima annaisimayu ilinnaarnaulauqaluartumik taima atseruuteqartutillu tamakku angiyoqqaariauyu ajaortaruartautuinnaqqu taima ikajoqattakullugi tuungaminnik angeqqaminni ilinnaaqassuaqattatillugi.
Right now, the discussions are happening at every level, and we're working to ensure that we have all of the challenges that we can meet them and ensure that our students will receive the best learning that they can, whether it's from a distance or whether it's in the class. So for right now, like every other jurisdiction across Canada, we're working to ensure that that is going to be best practices going forward. Juana.
Harutuinna taakko nalunaarsisimagasuaqatta tamakku atseruutiqartilluta pileriqatigiinnermik ilinnaarti tautsaanginnarunnaqullugit angiqqarsimagaluarluti ubbalu ilinnaarbi iluani taimiittuinnaumata kanatalimaami taima atseruutiqarnaartugu pilerijjutitsaangunerpaani malehattarluta qanuq ilinniatsaakatniirunnainnarnaarmangaata.
Jackie McKay, CBC. My question is for the Education Minister, so you can stay right there. CBC spoke to 7 FAN students who say that they had their applications in by the deadline but still haven't received their payments. Why hasn't the government paid FAN students?
Jackie McKay, CBC, kunni taakkuagu 7 ilinnaartini taakkuagavamakkunni kiinaujani kayusaartaahattartunik tutsiraarsimalertu tunisilaortutillu isuluttarpinganaalautinnagu
Juana, for the opportunity to speak to you about fans. We have been hearing from students regarding their payments, and I want to clarify an issue about the student enrollment forms. While students have the responsibility to submit their student enrollment forms to fans, some students have had issues receiving their enrollment information from their post-secondary institution and in time to meet their fans' payment timelines. So to these students, I apologize for the delays. I thank you for your patience and thank you for reaching out.
Huyannami tamanna hausarigunnaqakku kiinauyartigu ikayuussaartaahattarniginnu Nunavummi ilinnaarti tusaqattarsimagamaami suunersali ilinnaartini tamakku akilertau qattarsimaninginnut akilertau qattarsimanginninginnullu tukissinertitsigaarumajunga tamakku ilinnaarti atiliuqattariaqarningi ilinnaart ngutinginni nalunaeriarutini ilinnaarti pileriatsaqaraluartillugi tunisigiaarnermu tamakkuninga tataterialinni kiinauyartigu ikayuussaartuleriyikkunnuut ilangi ilinnaarti akaungiliorutiqaqattarsimayu tamakkuninga tukisigiarutinik silattusarbimminiingaartunik kinguvahattarsimalluti tamakku aqangakku akkilertaugutini isulittarbiutitaujunik Takun ngayon natin umamaya bigi bakka kingo bagay ako jaus mayunur ang malukuyan na may kasi utakis sa akong nakasimagat siya malukuyan na may kayok daw gaya kaswakat siya.
This is something that we need to fix, and I'm working with the department to address this as soon as possible. Providing financial assistance in a timely manner to Nunavut's post-secondary education students is our top priority, and we try to ensure payment as quickly as possible at the start of each new semester. I want to assure that these students, that the Department of Education is working with the Nunavut Arctic College to better align our process so that students do not face these unnecessary delays in the future. I still encourage any students who are having issues with their student enrollment forms or payment to reach out to me so we can look into this matter and investigate it for you on an individual basis. I also would like to thank all FAN students for their understanding regarding response times to emails. Our FAN's office in Iqaluit was closed due to COVID-19 in the community, and staff in Iqaluit and Iqaluit are working hard to stay on top of all these requests and inquiries. Juana.
Tamanaki gaktaw gakhalakito pilari khate khatu nga pilari ikhanaya bitin ni tamanaki ta khulugumana sautigikon kina yaktigo ikayo te khatam ne kingo waksumangit te minuna bumisila to sabing inek ilinnerting inutan tamanna sibuliuti gattigo Amalo akili ka so khatam ne agalo aktu khila mi unak pakut atunet pigali tay natillugi ilinna palyalak tillugi Nalunay bigi gumayak kata ko ilinna tulig ko pilari khate hangata sila to sabik ko ni tamako nalimuguilik taut sa akong nakhullugi tamako ato ataw khattari ilinna tino tamako kingo bagay ako taw khatam nang matakiliutit sa yunisibunit satinni ayaw to kaya kakka ilinna ta ko sumalo akaw ngilio te hakto ta ko pijutigillugi tatataktaw galit obalo akilik taw galit tatsumunga kaw jiga khullugi ta ko atunit kimik ko yaw khatam nang ta Kaya na may kamamiyak ka ta ko ilo na tiki na yan ikayo sa hatak tuilin na ati ta ko ato kisi umatsa na ningin no tamak ko kingo bakatakalo atin lugi kakisaw yak ko titirak tao yun. Ta ko alabing ta ko ikayo sa tulig ilin na atin wak biyani matus si malawan no kutsuang nakto kalaw ng nunangan.
They haven't received their funding and can't pay their fees. What do you have to say to those students who need the money right now?